So I'm 72. I have a husband and two daughters and two grandchildren and one golden retriever. Hobbies up until I got to be this age, and my husband and I got to be a little bit more infirm than we were previously. Our passion in life, and it was huge, was scuba diving, and we were all over the world. It's the only kind of vacation we ever took. Big trips, 2.5, 3 weeks to literally all over the world. And he's an underwater photographer, and so we ended up with quite a spectacular set of images that we've kind of designed a house around. We built this house that we're in 4 years ago. We just lived here 4 years. It was my husband loving me, and he found a lump, and he's a physician, and he didn't want to alarm me, but I also didn't want to ignore it. So he found it, without looking for it. He just found it, and it was a left-sided tumor. I felt it. He told me, where to feel it, and I felt it one time, and I was so freaked out that I felt this hard little rock. It wasn't much bigger than the size of a pea. It wasn't very big, but it freaked me out so much that I never went looking for it again. We had a fine needle aspiration scheduled. Went in, the guy took 3 samples, and we were supposed to go to Australia like 2 or 3 days hence. And they got a report back, and they said, no problem, you don't have any cancer. And then he said, but we might as well take that thing out. So we go to Australia. We're gone for 3 weeks. We come back. My mom is staying here with the kids, and she gets this call from the hospital. So we just wanted to talk to Susan about her surgery that's scheduled in a few days. And my mother's like, what surgery? Because they told us there was nothing. It was no big deal. And we called, and the guy had missed it 3 times when he did the fine needle aspiration. And he told me I had no cancer. And then we went and did the surgery, and they sent it to pathology, and they said, oh, that's positive. So that was an awful day. Just like everybody else, when they first hear that news, you kind of go numb and deaf and blind. And fortunately, with my husband being a physician, he was able to ask the right questions and chase this down and figure out what to do. And we live in Austin, but we ended up going to MD Anderson in Houston for my care, which was tremendous. The care was great. It was a lumpectomy, and they took 5 lymph nodes, all of which were negative, which was wonderful. I was in such denial, Alexis. This is amazing. This is really pathetic. But my husband, he's right over there. That's why I keep pointing there in the next room. When the lymph nodes came back negative, he knew what really good news that was. And I had really mixed feelings about it. It was like intellectually, I knew that was really good news. But emotionally, I was still in the space where I'd been a few weeks before our trip, which was, you don't have cancer. And I've learned a lot about denial. It's a powerful human thing. I remember 2 times realizing I had been in denial. One was 9 days after. So the doctor called my husband, and he told my husband, and my husband told me. And like I said, he's a physician. He's very compassionate, and he loves me dearly, and he was just very present for me. And there's nothing you can do. It just is a truth you have to face. So I made plans, and he figured out the MD Anderson piece. And I remember 9 days later, we had a plan, right? So I was okay. Then 9 days later, I remember driving up the driveway, and Chip stopped the car on the hill of the driveway because I had said something which made him realize I totally was disconnected from this truth. It wasn't internalized. The surgeon here in Austin who did the fine needle aspiration said when you get back from Australia, let's take it out. So as far as I knew, I was taking out a benign little something. And so it comes back positive. So I never had a biopsy because we were taking out, you with me? And then when I went to MD Anderson, they said, we need better margins. So they took, another whole section in the same spot, but bigger, and the lymph nodes with a sentinel node biopsy. She explained what a sentinel node biopsy was and how they were going to put a dye in where the tumor had been and watch what happened. And I thought that was fascinating that they could see this blue dye traveling, across me to the lymph system. Again, she just explained things, what she was going to do, and it was going to be a lumpectomy. I don't know that I remember a whole lot. I don't remember the recovery being difficult. Not that I'd ever had surgery before, so I'm sure I had to deal with drains and stuff, and I don't remember how long I was in the hospital. The oncologist recommended chemotherapy and radiation following that, and he gave me 2 choices. My doctor was wonderful. He gave me time. The oncologist, the first time we talked to him, to my astonishment, sat with us for 2 hours and 15 minutes. Isn't that unbelievable? Isn't that just like so awesome? We were talking to the oncologist who had a couple of choices about which path. He had a couple of options he was happy with for me. And one would mean I would lose part of my hair, and one would mean I would lose all my hair. This is the one over here that they called the Red Death, which people probably have talked to you about. I think it's adriamycin, I think. And the other one, I don't remember what it was anymore. What that little cocktail was, 3 different drugs. But that one I was going to have lose maybe a third of my hair, and I did. So, and then, my husband is a physician, so he had done a lot of research before we got there. So I really think I had such a good team that I kind of allowed a lot of what was going to happen to be researched and recommended by others instead of me having to do that myself. So the doctor says, so, let's talk about when we're going to get started. I didn't even have a chance to say anything that was in my mind. He goes, so what do you think? And there was something about his body language that I thought, oh my gosh, he's talking about right this minute, like today. And I looked at my husband, and again, he did the same thing. He's sitting on his chair, and he just had this completely neutral look, not encouraging me, not discouraging. It's December 18th. And I thought, oh my gosh, right this minute, Susan, this is on you. You got to respond. You're the only one in this room who's going to say the next words. You got to figure out what it is, and then you got to follow through with it right now. And I said, let's do it. And I was like, oh, I just agreed to my first chemotherapy right now. However, I also thought, okay, that'll be 1 down, right? One of my 6 will be behind me. And I was amazed at how angry I was every time a hair would fall out. And it took me a few months to realize I was angry at the cancer. Which is really unlike me to be like semi-violent, but it was all emotion. It's just a tough thing. So I was scheduled for 6 treatments, 3 weeks apart, and it was IV. I did not have a port; it was just IV. And so after the 4th one, they forgot to give me any antiemetics, any anti-nausea drugs, if you can imagine. They just forgot, and things happened like that. And we drove back to Austin, and I was sick all night. I was unprotected from the chemo, and I was so miserable and so sick that the next morning I said to my husband, I'm not doing that again. I'm not getting in the car and driving over there and giving those people my arm so they can pour those poisons. I'm not doing that. And he was so dear and so tender and smart, and he didn't say anything. He was sitting on the next to me on the bed, and he went, no judgment. He didn't support what I said. He didn't deny what I said. He just was this neutral. And then I just cried for a long time. And the fifth and the sixth time they got it right. So there was one beautiful part of that, which is the team at the radiation place said, there's this French cream, and we want you to use this for 2 weeks before we even get started. I want you to use this every day. It will protect you because eventually this radiation you'll be like a bad sunburn, and this will really help. Yeah, it's Biofin, Biofine. And so it's a daily treatment, 5 days a week, not 7, but 5 days a week. And I did what they said. I started 2 weeks with the cream, and probably 2 weeks or so into those 6.5 weeks, they said to me, you're using that cream, aren't you? And I said, yeah, I am. And they said, most people don't. Most people don't start. They don't do what we tell them to do. And they really get burned. And you're really in great shape for being a couple weeks into this process. You're going to be okay. And I didn't have a real sunburny kind of feeling probably till, I don't know, 5 or 5.5 weeks, 6 weeks into it, which was nearly end of it. What I didn't know is that radiation can scar deep down. So I ended up with, it was just the left side, they put the big heavy radiation blanket thing over you. And all the area that was irradiated had pretty terrible scarring that I wasn't aware of. I didn't feel it. Yeah, and I made the decision to go back to MD Anderson for the mammograms I can't remember if I went every 6 months for a little while and then graduated up to a year. I think that's what it was. I think that's right. But I went back to MD Anderson to do that. There was just a comfort level in doing that. And that, carried on, and then everything was negative, and everything was negative, and everything was negative, and it's 10 years later, and I'm like, whoa. Typically at 5 years, you kind of can consider at least remission, if not gone. But by 10 years, I'm like, got it. So I threw myself a party. I did. I had a 10-year cancer-free anniversary party. and people came from all over the country, and it was a lovely, lovely thing to do for myself and my friends. We all celebrated, and another 10 years went by before I had another cancer experience. But in the interim, I got Parkinson's. I got a diagnosis of Parkinson's disease, which was in 2015. So the first cancer was in the year 2000, and the Parkinson's was 2015. And then in 2021 was when I was looking in the mirror one day and I thought, that breast doesn't look right. That nipple looks weird. It was like kind of twisted and caved in looking. I was like, what? That's weird. So I went to my doctor, and actually it was the nurse practitioner that I saw. She didn't even have to examine me. I saw in her face real concern. And then she did examine me, and she said, I'd like to send you for a mammogram and a biopsy. And are you free to do that today? And I said, yeah, sure, I can do that. So she worked the system that all that happened the same day. And I had, oh my gosh, I had no idea what a biopsy really meant. It hurt so much. And, the technician, if that's the right word, I knew she was going to do several, and after 3, I just thought, oh no, if I can just be here and let this happen, keep going on. And she apparently needed to do 4, and she said, so you ready? And I thought, no, no, I will do it, but I'm not ready for it. And I'm not going to get ready for it because wow, it, it felt like shooting with force, with velocity, with pressure, like like shooting this big opening thing right into my flesh so that they could pull out a section of me. But it felt like this powerful force that it took to get to that lump. It just felt like a rocket. It was just so fast and so strong. But that was a picture in my mind, is that there was this thing, this giant thing that they were pushing through me, but in fact it was much smaller, but it was just awful. It was really painful. But I survived that, and um, very quickly found out that it was a completely different cancer than the first one I had. This one was estrogen positive. It was progesterone positive. It was one of them was ductal and the other one wasn't. I can't remember which was which anymore. But it was completely different. So it wasn't metastatic and lingering for 20 years. That's awesome news. But it was a little bit stunning to discover I had a second breast cancer that was different. And so I didn't want to have just one breast removed. And I said, if we're going to do this, let's just do this bilateral, because the tumor was right underneath the nipple. With the bilateral surgery, mastectomy, and of course they sent everything to the lab, right? They found a completely different, another cancer in my right breast that the mammogram hadn't shown up. And it wasn't the same as the one in my left breast that time or the one 20 years before. So I've had 3 different types of breast cancers in my 2 breasts. It was taken out as a result of me saying, let's do bilateral. I didn't want to have reconstruction, so I was going to end up flat. And I was just working with aesthetic flat closure. That sounded great. It sounded like it would be pretty, and it would be fine. And somehow, and I never looked at pictures. I didn't ask to. The doctor didn't offer anything like that, because I came in kind of prepared with, I don't want to do reconstruction. And as I said, aesthetic flat closure sounded nice, right? So not looking at pictures probably was a mistake. I didn't not look at pictures intentionally. It just never occurred to me. So if the patient story's goal is to help people who are in this process, as really difficult as it is to look at pictures, you can learn things. Because I didn't know until I got home and I took off all the bandages and the dressings. I didn't know they took the nipples. And so there's this completely flat and caved in on the left side chest with nothing there. And yeah, there are things you can do, there are tattoos and stuff, but they had no choice. They had to remove that because that's where the tumor was. And of course, intellectually, I knew better, but oh man, it was really hard for a year. I mean, I now, which is a little over 2 years, I don't shirk away from my own image in the mirror, but I did for a long time. People could tell me all day long, that that's not who I am, and that's a social construct, and that's blah blah blah, whatever. it's kind of like, yes, that's true, and that's true, and all those things are true, and that doesn't touch the fact that, I'm rattled here. This is hard. And so I guess I just let it evolve as long as it took, but man, it was a whole lot longer than I imagined it would be. And at that time, I had long hair. I didn't have chemo, as you heard. But after having had Parkinson's for 6.5 years, I think that's what it was, I decided to do the deep brain stimulation surgery. So I had brain surgery, and they had to shave my head for that. So I didn't lose all my hair with cancer. I lost my chest. I lost that sense of softness and femininity. So I had a huge hit to my sense of myself and my sense of femininity. And I wore scarves for a while, and then I wore hats, for a while. And then I wore a wig, and finally I just said, you're not going to have long blonde hair anymore. You're not going to have long hair for years. Might as well get used to it. So I had to put the wig aside, and every day is different, and it's just, it's a bitch. Cancer is a bitch. It's really hard. I guess you can just get used to anything you need to get used to over time. I have so much that's wonderful in my life, and I couldn't live in that sad place. I had to embrace it and acknowledge it, and I did, and I think that allowed me to eventually stop being in mourning. I think the permission that I gave myself to kind of say, yeah, it's exactly what you just said. I hung on to the fact that it mattered to me. So everybody's attempts to cheer me up were sweet, but it just didn't touch it. But I'll tell you what I did do before the surgery, and before I knew I wasn't going to have any nipples, and before I knew my hair was going to do this. This is really cool. This is if there's any highlight to finding out you have cancer, this is one of the best things I ever did. I decided I was going to have a sunset rooftop ceremony before my surgery to thank the girls, to honor them for everything they had done for me, for feeding my kids, and contributing to my sense of myself. So I wrote to all my girlfriends, and I said, I'm going to do this, and I wanted to be alone. And and I said, if you have any songs that you would want to send to me, my niece told me she'd make a playlist for me. So I was up there by myself for about an hour and just soaking it all up and finding these gifts. And so I that playlist, it's everything from I Am Woman, Hear Me Roar, to, I don't know, to the Beatles. And so I went into my surgery in this great headspace. It's really, really cool. So I put that out there for people about to have surgery. I think I would say this. I think I would say communicate whatever you're feeling without fear of judgment from others, without concern of other people's concern for you. Don't keep stuff in. Believe that these people who love you are there for you, and don't try to protect them. Be honest with your whole truth, because some days you're gonna feel better and some days you're gonna feel worse. When you are that truthful, you do yourself a service. So I think that would be my answer, is to communicate all the time with the people who matter.